Hello everyone, I'm Dr. Dharani and this video is a part of the series that I'm doing regarding Step 1 exam preparation. And in this video, I am just going to go through my FA and tell you guys what I feel is the most high yielding topics or how a particular system or chapter should be approached. So we'll just get started. First off, we have the cardiovascular system, and as you guys all know, there are a lot of high yielding topic in this, and you would definitely study them all, like congenital heart diseases, and then we have different type of hypertrophies, and we have aneurysm dissection, all these things which should not be skipped and completely studied, especially the pathology part of it. I think the physiology part could be a little bit challenging for students. I felt it challenging, but I think we need to know the pressure volume loops, cardiac cycle, Weger's diagram, and also these pressure volume loops of valvular diseases. So these things need to be understood like very conceptually for us to be able to find answers related to those questions in the exams. But once you master these diagrams, there isn't going to be questions that are very indirect. Like there would be these diagrams and then they would ask you what type of valvular disease it is or other kind of variation related to them. So definitely concentrate on these diagrams and also all the formulas in the physiology section. But I felt during exam it was mostly from the pathology part. And then we have the endocrine section, and that is also physiology is again very important. But once you learn physiology, pathology of endocrine section is just going to be absolutely easy because it's so conceptual and it all has like a proper science behind it or proper concept behind it which you could understand. And thyroid is very important, and one thing about endocrine is always know the key association of diseases and especially carcinoma related to the endocrine section. But again, I don't think there's anything that you can skip in endocrine. You kind of have to read it all, but it's one of the easier systems. And then we have gastroenterology, gastrointestinal system, where again everything is important, but the congenital embryology part is like really important in gastric system. And then in pathology, the carcinoma, especially the gastric cancer and the colon cancer are high yielding topics. And then we have the hernia, which is just very important. And always make sure that you know the physiology well, especially the blood supply of stomach and even the bilirubin production, the cycle, and other things related to it. And again, Meckel's diverticulum, Hirschsprung disease, interception, valvulus, these are such high yield topics from gastrointestinal section. I think pretty much everything is important, but just when you do your world itself, you would know like what are the things that you need to concentrate on. And at the end of the day, image-based questions are again important, and key associations. For example, if it's positive anti-nuclear, anti-smooth muscle, anti-liver or kidney microsomal antibodies, you need to be able to figure out with just that it is autoimmune hepatitis, because the other symptoms or signs they would give would kind of be matched with all the other options as well. So it's important to know such key associations. For example, in liver diseases, insulin resistance is associated with non-alcoholic fatty liver disease. So it's always important to know such key association. Fatty liver, microvesicular fatty change, along with mitochondrial abnormalities. It's common in Ray syndrome, so there are always like key findings like that are important. And then hematology, anemias, all the anemias are important, especially iron deficiency and intrinsic hemolytic anemias all these pathological findings like Heinz bodies, white cells, Burr cells, all these needs to be known for their hematological picture. You need to know what the blood smear looks like. And again, there are different type of porphyrias and heme synthesis, and also platelet disorders. All these are really nice to read. Like, I'm saying it after writing the exam, but I know that they are really challenging. And then there's also non-Hodgkin lymphoma and multiple myeloma and myeloproliferative neoplasms. All these are like a really high yield, and you could have like direct questions. For example, they could just show you smudge cells, and from that you can say that it is CLL, and they could show you all rods in the picture, and you'll be able to figure it out it is AML. And similarly, there's characteristics of multiple myeloma with hypercalcemia, anemia, lytic lesions, and so on. So hematology, again, key findings are like really important, and make sure that you have mastered the hematological picture. And I really feel the pictures in FA are like more than enough. Maybe FA and pathoma together. UWorld, you can use it as an assessment tool, but I feel if you master like what the picture is mainly about, then I think you'll be able to get the answer. And then what do we have? Musculoskeletal system. This was the most challenging system for me, and it's just like I feel, let it be upper extremity nerves or lower extremity nerves. With this, it is just highly volatile, and it's highly confusing because all the different nerves have like similar function, and they are like next to each other, so it is a little bit difficult to remember. I would definitely suggest to have like repetitive revision when it comes to musculoskeletal system. And for me, I had to put like, if I revise other system once, I would like do musculoskeletal like 5 times, especially the pages that contains about nerves. I think the pathology section is more easier, similar to the rest of the systems, but these, the anatomy session and like that is really challenging for sure. So that needs to be revised again and again, especially like, let's say 30 days before your exam. Every 4 days, like, allot half an hour or an hour and a half to just revise those nerve movements and things related to the nerves. So I think that could kind of make you enhance your knowledge about nerves and movements and muscles and all of that. But I think I think in FA, while doing UWorld, I just understood that muscles and their exact movement were not clearly given in UWorld. Like, I was not able to do UWorld with just the information given in FA, and I had annotated like the exact muscles and all the movements that were asked in UWorld altogether. Maybe I would upload it in one of my socials, and you can have a look at it or use it for studying. And then what do we have? We have CNS. This again was like really challenging for me. Everything in CNS is very important, but it's also again so vast, and I think I annotated like triple the information for CNS compared to other systems. Embryology is important, and even physiology is like really important. You need to know in hypothalamus or thalamus, you need to know the nucleus and their specific function. And this again, like musculoskeletal system could be really volatile, like the different nucleus or different parts of brain, different dopaminergic pathways. So definitely like go through it again and again during during your dedicated period, even cranial nerves and their function. So, and even the pathological part of it, be it neurocutaneous disorders, and especially the adult and the pediatric brain tumors, these are really volatile. Even though you'll be able to understand it, the diagrams are very like specific for each type of tumor, it's again like so volatile, it could get confusing, when they give all these findings and they have all these options that contains only brain tumor. It could get confusing also. I think it's important to revise it again and again for sure. And even ophthalmology, I felt you need to revise it again and again, especially the Horner syndrome and the 3 different types of nerve palsies and internuclear ophthalmoplegia, like all these concepts, even though they're very conceptual and like so interesting to read, they're again volatile and could be confusing. So definitely like revise it multiple times during exam. Again, urology, pharmacology is a high yield topic, but at the same time very challenging to read, memorize, and so definitely revise it a lot of times during a dedicated period. And for psychiatry, I think the table in which they have given diagnostic criteria by symptom duration, that is like really really important. And then along with this table, you can annotate the duration for the diagnosis as well. Like this is actually how many months or years after which you can diagnose a condition. But there are also like for example, in childhood disorders, like you would know the age of onset is very important. So for the other diseases, the duration is very important before diagnosis, but for childhood disorders, the age of onset is also important. Like I have annotated a page where I have mentioned the onset age and also the duration before which we can diagnose. Maybe I'll upload that on my socials as well. And then you would also get like a lot of communication questions that are like based on ethics. Like that is something that I came across in exam based on psychiatry. Again, renal and RS are like pretty much direct questions, and they are easier to understand as well. Like you just have to know it conceptually well, and then I think you'll be able to do the questions well as well. Again, reproductive is also more conceptual. It could get a little confusing, like the different type of sex development disorders, when the options are so similar to each other, and it could get confusing, but you just have to know the key association, and also know the key association between different types of like ovarian and uterine tumors and uterine conditions. That will help. So this is about like the general systemic. And coming to the general, I think, where do we start? Biochem. Oh my god, I think I really postponed my exam like multiple times just because I was not able to ace biochem. But then there are a lot of different things that I followed. First off, I made this huge chart for myself with like different cycles and try to like revise it again and again. But I don't think the questions in exams were like really concentrating on cycles. It was mainly dealing with direct like pathological diseases, or for example autosomal trisomies. You need to know what is a key finding, or vitamin deficiencies, or even with other metabolic conditions. You need to know maple syrup urine disease, and urine has like burnt smell appearance, alkaptonuria, and urine turns black on prolonged exposure to air. So there are a lot of diseases in biochem which has like very key findings that you'll only come across in that disease. But since there are so many of them, it's difficult to learn for sure, but highlight them while doing your world or while learning, and just concentrate on those key findings, and that will enable you to kind of do biochem. I think even in exams it wouldn't be like so confusing. The options would be like you will have one key finding and you'll be able to directly go for the options without confusion. So that's a way in which you can study biochem. We have immunology next, which is also concept based, but there are also like things that could get like a little confusing, like the different types of immunodeficiencies. You just really have to mark all of these things which are volatile and just spend more time on revising them compared to the conceptual things that we come across. I think one major mistake that I was doing for a long time was I was reading everything with the same weightage of time without really concentrating on things that need more number of revisions, and that's why my NBME scores were like low for a really long time, and I couldn't take my exam for a really long time. And it only started improving once I started concentrating on things that are more volatile, like very close to my exam. And I was just like, this is like really close to my exam and I'll revise it, because I used to think that I'll revise these things just before exam, like 30 days before exam. But during NBME, like 3 months before my schedule, like first NBME, 3 months before my scheduled exam day, it would like really be less and not sufficient enough for me to take the exam. So definitely don't get like scared while getting a new low NBME score if it's like way, you know, before you're dedicated. If it's, you know, I think before 2 to 3 weeks, the NBME that you give, like that makes more of a sense, because you would have like crossed half of your dedicated time and you would have revised all these things that need a lot of revision. And then we have microbiology is all about the images, like images everywhere, every single, like let it be bacteriology, virology, parasitology, images. Just make sure that you have mastered the images. And I didn't even use sketchy or anything, like I'm not a person who can, you know, kind of have the story and then I would be like, I would remember the story, but I don't know if I can remember like what determines like what specific thing in the story. So I'd be like, I'd rather like read directly the actual concepts. And I just did it. I think the diagrams are what's so much important in microbiology, and once you aced that, it's well and good. And I used to like kind of not study the last few pages and also the general bacteriology for a long time, but even though they are like so dry and like single line for a single, like, you know, we have all these culture mediums and what are their components, and even though they are like so dry to read, you need to do it during your dedicated, and it's kind of important as well. You can get direct questions. And the antimicrobial, there are a lot of conceptual things like resistance and stuff like that. You will be able to understand it, but it's easily volatile too, so you need to concentrate on them during your dedicated, or just like have a note of like which antibacterial or which, you know, antimicrobial, what exact pathway of resistance or what exact adverse effect. Like the resistance pathway and the adverse effects are like the two most important thing. And I think the method of action is also important, but once you know the concepts, you'll be able to remember the method of action of the antimicrobial, whereas the resistance pathway and adverse effect could be confusing between different ones. So just like concentrate on that. Pathology, follow pathoma. FA is also like really good for pathology. I used pathoma like, you know, during my last 30 days of prep, like I used to hear pathoma whenever I'm traveling and doing work, like keep it at 2x speed or something, and just like hear it and just ensure that I know everything that, you know, he's saying, that sort of saying. So that's how I use pathoma, even though I used it in like, I've studied it before, I've gone through the entire video modules before, but it was like a couple of years before I took step 1. So during, like, I didn't go through the book at all, like I just only listened to the video lectures just on high speed, like continuously for 30 days before my exam. And then we have patho, again these oncogenes, tumor suppressor genes, let it be carcinogens, serum tumor markers, and paraneoplastic symptoms. Like the last 3 pages are really difficult to keep in mind because of how much dry it is and how much volatile it is, but you can save it all for your dedicated period as well. Like you'll be able to read it before, but you can't exactly like master it. And even if you do master, like, you tend to forget it, so keep it saved for your dedicated. I definitely found like pharmacokinetics and dynamics really challenging. I saw a lot of videos, like video lectures for it, but like nothing was making much sense to me, so just ended up like learning to how much ever I could, and I just like, you know, did not really focus on mastering it or anything. But you know, the autonomous drugs are like really important, not just for the exam but also your practice as a resident, especially if you're going into the clinical field. But I think it's quite conceptual, and if you read it again and again, you will get it. And then finally we have ethics and biostat. Ethics is good in FA, but I followed the 100 cases book, and it was a game changer for me, because I just feel like it makes so many ethical concepts so clear. And I was scared to take up the 100 cases book, because it was like, will I be able to, you know, learn that many things? But actually once I started going through it, it was like a story, so I did not even have to learn anything. It was absolutely just reading and just marking things. And I would go through the ethics chapters, and in the front you'll be having index, and then even in the index the concept would be given, like for you to have like a revision before exam. But just in those two pages I've annotated, I would go through a chapter of the 100 cases, and then I would annotate like the key concept in the index page, so that I was able to revise those 2 pages alone during before the exam, right before exam. And biostat was again complicated for me, but there are a lot of video lectures for like specific and even shorts, because I was freaking out a couple of days before my exam. I was seeing a lot of shorts for the biostat, and a lot of them like make so much sense and makes things very easier to understand. I think you can get like all these concepts of like odds ratio, relative risk, and RRR and ARR, all these things, and even precision, accuracy, sensitivity, specificity, all these things you'll be able to like learn by your own. It's not that complicated as a concept. But I think for me, these like type 1 error, type 2 error, conference and interval, like these were really challenging, and I watched like a lot of YouTube videos for it, and it definitely like helped me. So, but I think in exam I did so much for ethics, and then I ended up getting like questions that I have not come across in FA as well as Euro, like totally new concepts. But they were like only a couple of questions, and I think every competitive exam would have questions like that. And I think we have pretty much finished it. So this is like, we just went through a quick chapter wise analysis. But I think at the end of the day, you need to segregate like a lot of the things are conceptual, but a lot of the things are also like highly volatile. So definitely differentiate or mark the things. Like you can see, I have like all these bookmarks. I haven't taken them after my exam, so I have like all these bookmarks of like pages that are so volatile, and I know that it's very important to like revise them before exam. So you can also mark them and just read it again and again. And we cannot study everything the same weightage. We need to know what are the things we need to revise more and concentrate more on your weak areas. And especially if the score is low, like I think a major thing that people would be doing is not really concentrating on weak areas and being scared that they would forget the things that they are already good at and just revising it again and again. Don't do that. Definitely allot time for the weak areas and for volatile things that you have marked, especially during your dedicated. If your dedicated is like 30 to 40 days, first 20 days you would have revised all these volatile stuff like multiple times, and then 20 days or 15 days before your exam give NBMEs, and those scores are like more valid and they are more predicting of the exam. So for any doubts, you can comment below. I'll be making a few more videos about step 1 preparation, and you can also connect with me through my socials. Thank you.